training group and observers, that's what I believe, for this Tuesday, Wednesday, Thursday, 2.5 days of PBL tutor training. And there's a core group of you who will be PBL tutor trainers for the future. So pay attention. But many of you are already thinking actively about PBL, are already trying to see how it works in your environment. So what we're wanting to do first here is just get some alignment of our understandings. When we start a PBL group, we always start by getting to know everybody. So in this first part, what I would like you to do is we're going to give the microphone, and it's going to go right through the room, and everyone is going to say who they are, where they're from, and why they're here. There's one other thing I want you to do that we always do with our PBL groups when they're new. As a tutor, we want to create an environment where people are a little bit more relaxed. So you also have to say what your favourite Vietnamese food is. And we will be listening very carefully because we need to go for dinner tonight. Yeah.
My name is Khoa, Dr. Khoa. I work in the Department of Neuropsychology in National University. Yes. Yes.
So what is your favorite Vietnamese food? You can't say
Yes. My name is Mai. I am a bacteriologist and I teach microbiology from 1985. But I am very fond of PBL.
And your favorite food?
It's a kind of rice, but it's my grandmother product. It's very, very nice, very good.
Does it have a Vietnamese name?
Soy man.
Hello. Yes. My name is Minh. Yes, I am a doctor and I teach microbiology here. And it's the first time I learned PBL. And I am very, very happy when to try these courses. My favorite is, I think I like Vietnamese food very much. For example, pho, bánh cuốn, because I like fish sauce. And you, do you like Vietnamese food? And what kind of food do you like? Okay. Thank you.
Thank you. I'm Dr. Khoa, specialized in endocrinology. Yeah. I work at the Pham Ngoc Thạch University, Pham Ngoc Thạch Medical School. The other university is belong to the city level university. I like physical exercise. Yeah, every morning. This is the second time I had opportunity to approach on the PBL. The first time I learned I have a class with Đhqg. Yeah, but now this is the first time with the foreign teachers. I like it.
My name is Tan. I am a lecturer of faculty development in Phạm University of Medicine. This is the first time I attend this course of Final University, and I want to improve my knowledge about teaching methods, assessment methods, especially problem-based learning. And my favorite food is actually.
Thank you. So I understand you're from the pharmacology. Pharmacology is the main. Yeah.
Good afternoon. My name is Hugh. I'm Dr. Hugh. I'm working in the School of Medicine, Vietnamese University as teaching assistant in the Department of Molecular Biology. Yeah, today I'm very happy to stay in here and learning many things, exciting things from you. And actually, your question about my favorite food, I really like pho like everyone. Yeah, it's every morning. Yeah, and nice to meet.
Are there different sorts of pho? Are there different sorts? Maybe some like the fish one or the pork one or the chicken one. Is it only beef?
Beef really the more popular of pho.
Good afternoon. My name is Duy. I came from Urologist Department at the Vietnam National University. And problems by learning is the key method to teach in current days. So I want to explore it and improve my abilities. I want to participate in this course. And my favorite food is maybe it's weird. Let's talk a little bit about my hometown. It's in Đhqg province, which is a mountain province in Mekong Delta. So in there we have signature dish about mouse. Yeah.
Now you've got my attention.
Yeah. I know you will feel it's ridiculous and so weird. Yeah, but this mouse eat rice. Yeah, they are very clean and it's very tasteful, delicious. Trust me.
Có.
My name is Han, and infectious disease of Vietnam National University.
Hello everybody, my name is Như and I'm from the Giảng province and I'm a lecturer in the infectious disease, yes, and I'm working at the hospital, hospital of tropical disease, yes. My favorite is broken rice.
Hello. Good afternoon, teacher and everyone. My name is Han. I'm from Department of Obstetrics and Gynecology. I had 3-year residency in University of Medicine and Pharmacy, and work with team-based learning method. It's a very good method. And now I'm working here and I work with the problem-based learning. I think it's a good method too. So now I'm coming here to learn and to understand this clearly. My favorite food, Vietnamese food, is rice. It's an important part in every meal Vietnamese. Thank you.
Good afternoon. I am Bin. I come from Đhqg department, and I am very happy to take part in this course. I hope I can improve a lot of more knowledge. My favorite food Vietnamese corn is bún đậu mắm tôm. It's consists of many it's conclude noodle, meat, and tofu. Yeah. Thank you. No, the fried tofu. Yeah.
Hello, my name is Nhung, Sung. I'm in Đhqg and Biology. I'm a doctor, and I have one PBA when I school. I studied this school. But I come here with the other device. And my favorite food is the breast in Vietnam. It's different than other countries. I think it's so delicious. Bánh mì, bánh mì.
May I introduce myself? Okay, yes. Yes, my name is Dung. I'm from the Department of Đhqg. I'm here because you actually said that. Yes, my favorite food is something made by my wife. Yeah, so that's me. Everything made by my wife. I love that much. Yes. So I don't care who you are, where you're from, just as long as you be here with me today. And actually, I have a chance to get acquainted to PBL 5 years ago. That's a very good chance for me to learn how to practice in PBL learning setting. And I know that for at least 10 years ago, it's quite different from now. And today, my objective that you need to share with us your experience, how to apply the PBL in the modern medical education, and also specifically clinical setting. And also the setting in clinical education in Vietnam quite different from Australia. Yeah. We need to discuss more on that. Yes. Thank you.
Good afternoon and say hi to everybody here. I am Hart. I am a Master of Industry and Pharmacy from University of Medicine and Pharmacy University. And I'm from Đhqg provinces, and I'm here to learn all the things you give to me. And my favorite food is, I don't have my favorite food because I love all Vietnamese food because I am Vietnamese and I love Vietnamese people. Thank you.
Good afternoon. My name is Phương. I'm a pharmacist, and my favorite food is Phở. That's all.
Hello everybody, my name is Hồ Minh Tuấn. I come from Obstetrics and Gynecology Department, Vietnam National University, and my favorite food is cơm tấm, broken rice. Okay.
Good afternoon. My name is Anh. My major is internal medicine. I really passionate on cao lầu. This is it's famous in Hội An City, and my hometown in here is. Do you know Hội An City? It is the central part of Vietnam. In the central part of Vietnam.
Hello everyone, my name is Khoa and I'm a doctor in the Department of Pediatrics in the School of Medicine. I'm from Ho Chi Minh City here, and my favorite food is broken rice.
Good afternoon, my name is Diễm. I'm a microbiologist. I'm from the Vietnam National University School of Medicine. My favorite Vietnamese food is phở. Thank you.
Hello everyone, my name is Phương. I'm from the Pediatric Department, School of Medicine, BNU. Actually, I have learned as BBL when I was sixth year medical student at University of Medicine and Pharmacy. When I was learning at Đhqg Hospital, that's the ONG department taught us. Yeah, but today my objective is under another perspective. Yeah, like a legal instructor, and I want to observe everything from you. Yes, about the objectives, why we apply BBL on the medical education, and how we can practice it in the medical situation or environment in Vietnam. Yeah, and thank you for your presenting here today for teaching us. Yeah. Sorry, my favorite food, and I didn't see any recommendation from the other doctor here. Is green and brown. Yeah, you can find it on the restaurant or on the food street. Yeah, spring and roll. Spring and roll. Yeah. Sorry, I didn't pronounce it well.
Good afternoon, everyone. My name is Tin. I'm pediatrist, and this is the first time I'm here for PBL training. Yes, and the reason why I'm here because of my I want to improve my skill in teaching students. Actually, I prefer clinical practice. And today I'm here to explore the strengths of PBL. Yes, my favorite food is Vietnamese pancake. This is special case from middle of Vietnam. It's my hometown too. And in 30 days, I miss this food. And on my phone, I say the phone number of the yes, the phone number, and can call. So when I want to eat some of it, yes. and if you have have a time, I would like to invite you to sit down with me. And I call her now. Yes. Thank you.
Hi everyone, I'm T. It's a pleasure to talk everyone. I am a doctor. I'm a bachelor in pediatrics. I'm working at Children's Hospital 1. My favorite food is seafood and durian. Thank you.
Yes, hello everyone. My name is Phương. I'm a pediatrician and lecturer in the pediatrics department. I'm really appreciate to join in PPL training course. Yeah, my favorite food is shower soups and meeting with many topics. Yes, nice to meet you as everyone.
Hello everyone, I'm Dr. Mai from the Pediatric Department. And like everyone else, I come here today try to find a way to carry out the BBL method effectively and to help my students to develop a good self-learning skill in their life later. My favorite Vietnamese food is lẩu, hot pot in English.
Good afternoon, everyone. My name is Long, and my specialty is ENT, and I'm a doctor and lecturer of ENT department of School of Medicine. This is my first time in BBL training. It's hard for me to describe my mood, so I'm eager to start patient. And my favorite food is bánh xèo. It's a kind of pancake with pork meat, beans, sprout, and sometimes straw. Thank you.
Hello, I'm Yuan. I'm a dermatologist and a part-time educator. As I teach 2 courses here. I teach medical ethics and medical English. And not very good at both, so I'm trying to see if I can bring PBL to my courses and make it more interesting.
Hello everyone, my name is Phương. So I have working at internal medicine and infectious diseases of BNU, and I'm very honored to be here to improve my knowledge. And my favorite food is seafood. Thank you.
Good afternoon, everyone. My name is Pháp. I'm from the Department of Ophthalmology, BNU School of Medicine. As you know, the Dean said this morning, the PBL learning and the teaching is the core and the very soul of this school. That's why I'm here to learn it in more detail and to carry it out more effectively. And my favorite book is Đhqg, the one President Obama ate when he was in Hanoi.
Yeah, hi everyone, my name is Yi. I'm a lecturer in Medical Skills Department at School of Medicine. I'm really interested in this course. I hope I can learn a lot from this. My favorite food is chicken curry.
Hello everybody. I'm a doctor teaching School of Medicine Vietnam National University and work at ENT Hospital. My favorite food is noodle soup with chicken. Thank you.
Hello everybody. Hello Mrs. Jiu and Mrs. Julie. My name is Phong. I work in internal medicine department. I have practiced BBL when I was a student. Yes, in Vietnam National University, and I come here to have a chance to improve my knowledge and improve my skills, and I hope that PBL will be my effective tool to have the students can learn more and more knowledge in medicine. And my favorite food, my favorite Vietnam food is the phở. Yes, thank you.
Hello everyone, good afternoon. My name is Yu. I'm a doctor in obstetrics and gynecology. My favorite food is phở. I'm glad to be learn in take part in the training course program today because I want to know how to organize the BBL class.
Hello everyone, my name is Inu. I have been graduated from School of Medicine for more than 2 years, and now my major is doctor in general medicine. And when I was a student, I used to study BBL before, and now with a different role, a teacher, I want to know more about this and want make student can more easier for study by the way to study BBL. And my favorite food is one of special kind fruit in Vietnam and maybe a tropical country is durian. And I think that you so strong recommend you to try it one more time. Thank you.
Good afternoon, everyone. My name is Ben. I come from the surgery department of School of Medicine, VNU, and I'm here today to learn deeply about the PBL because my knowledge about PBL is still vague, and this is such an opportunity for me to have preparation to teach the student in PBL in the future, and especially I have my favorite in every food made from chicken. Yes, thank you.
Hello, my name is Tùng, and I'm a surgeon of thoracic vascular surgeries. I also work at the surgery department, and my department had the responsibility to teach students not also the knowledge but also the basic skill of surgeries. So I'm here to study the methods how to get the student at the study effectively. My favorite food is everything wrap and roll. Yes.
So, good afternoon. My name is Lê Xuân Lộc, and I come from the Department of Pharmaceutics, Vietnam National University School of Medicine. I'm here because I want to keep myself updated with the current effective teaching method in PBL. I was born in central Vietnam, so I was surrounded by many kind of good food, and that's why I got a lot of food that I like. But the food that I go crazy for is chicken rice and mangosteen. Thank you.
Good afternoon, everyone. My name is Lee. I'm a doctor. I come from Minorities and Public Health Department. Today, I work here because of PBL training. My favorite food is all food of Vietnam. Thank you.
Hello, everyone. Hello, Professor. My name is Hai. I'm a tutor of public health and epidemiology, the same of Lim. I would like to say thank you to all of you to come here and share your method to us. And my favorite food is many foods here because it's not fair for me and all the behind me because many people think the food the same of me, phở rồi sticky rice, and but I enjoy bánh xèo. It's a Vietnamese sauce. When you make it xèo, it's a bánh xèo. It's cool. Thank you.
Hello everyone. I am Sơn. I am a pharmacist and a new participant of medicine faculty. So that's the reason that I'm here today. And about my favorite food, I think the best for me is roasted ground meat and rice noodle with a lot of vegetable, fresh vegetables.
Good afternoon, everybody. My name is Đhqg. I'm a lecturer and researcher from the Department of Biochemical and Molecular Biology. And as a lecturer, I know that for education, besides your knowledge, the method and the skills, teaching is very important. And I also know that PBL is a very well-known and effective teaching method, so that's why I'm here today. And since the 5th month of my pregnancy, I have increased appetite, so I have a long list of favorite food now. Sticky rice, etc. So many kind of food, yeah.
Hi everyone, my name is Nhã. I'm teaching epidemiology. After class, I hope I can use PBL methods in public health. My favorite food, maybe bún riêu. I suggest you should try bún riêu after this class because it have many herbal. It's good for health.
Good afternoon, everyone. And my name is Nguyễn Thị Hà. I'm a lecturer from the Department of Pharmacy. And as everybody know that PBL is a very effective way to give lecture. However, in my department now, Department of Pharmacy, we haven't been applied PBL yet. And I hope that after this class, I can apply some more new technology to make my lecture more effective for my students. And concerned about Vietnamese food, I think that in Vietnam have a lot of delicious food, and you can heard about from the beginning. And I suggest that you should make a list of this. And I also recommend a very delicious food is the seafood hot pot. Because I love seafood, I love vegetable, and seafood hot pot can a great combination of both. Thank you.
Hello, my name is Vân. I'm from Human Physiology Department. I think my humble intention to be here is to find out what we've been teaching here is actually BBL or not, and find a way to apply the BBL in the teaching and self-learning. I like all Vietnamese food, but I just have my favorite fruit is the sugar cane. Yeah. It looks hard, but when you crush it, you feel the sweet. Thank you.
Good afternoon, my name is Duy. I'm a lecturer in anatomy department. This is the first time I attend BBL training course. So that I want to improve my knowledge, how to transfer my knowledge to students. And my delicious Vietnamese food is bún nước lèo, a kind of noodle in Trà Vinh province.
Hello everyone, I'm Dr. Yu from Internal Medicine at BNU. I have been teaching BBL for 1 year and I come here to enrich my college about these skills, and my favorite food is Creole food.
Good afternoon everyone. My name is I'm a doctor and lecturer from ENT department. This is the second time I had a chance to attend to BBL training program. And I think this course will helpful for me to improve my teaching skill in the future. Because I live nearby the sea, so my favorite food is one kind of seafood.
Good afternoon, everybody. I'm Trí. I come from immunology department, and I come from medical center. So of course I love fruit, and I think everybody should try it.
Hi everyone, my name is Vũ. I am doctor. I from Department of Gastroenterology in Technology and Liver Disease. It is the first time I attend BBL training program. My favorite food is seafood. Thank you.
Hi everyone, my name is Steve, and I'm work in Department of Technology, Histology, and I come here to know more about BBL, and my favorite Vietnamese food is one kind of noodle. It's named bún chả cá. This is fish noodle. Yes.
Has every trainee had a chance to say hello? Is anyone missing still? Anyone not yet? Who is a trainee? Yeah? Yeah.
My name is Đhqg. I'm from Khoa. Thank you.
Good afternoon. I'm Dr. Ton from Tây Province. I work in neurosurgery department. In the first I attend the PPL. My hobby in the first is Pháp. Thank you.
Good afternoon, teacher. Good afternoon, ladies and gentlemen. Maybe I'm the last one.
You are.
Yeah. My name is Nguyễn Quốc Dũng. Yeah, I'm a lecturer. I work here. I'm a pathologist. Yeah, I come from the Department of Histology and Pathology. I like very kind of food shows. It makes me overweight. You see.
Me too.
You've all just solved my big problem. My husband has asked me to come back with some Vietnamese recipes, so now you all have to write it down and give it to me, and I can be happy.
We will learn from you, Vietnamese food and cooking. So, we took a lot of time there for everyone a chance to introduce each other, but I hope now you're getting a better idea of who is his, and you've had a chance to speak up and start to engage as a group. I saw recognition and enjoyment as you were sharing each other's favourite food. What I hear is that there are some people here who have never had any exposure to PBL and who are here to get the basics. And there are other people who have done PBL but worry that they're not quite right in their technique, who would like to improve their PBL tutoring. And there are other people who have been students in PBL classes and are now making the transition to being a PBL tutor. And it is quite a different thing. Students often don't appreciate how busy a tutor is because they're like a duck on water, serene, but paddling madly underneath. So you will find this. I also was pleased to hear there is a range of people from basic scientists, histologists, etc., biochemists, and then through the clinical disciplines, we're very well represented by microbiology, by obstetrics and gynecology, by pediatrics, internal medicine, but I'm also very pleased that we have quite a group of surgeons. So you really are across the curriculum, from your basic scientists right through to all your clinical disciplines. So this is the community of practice for the whole course. and for your courses. I also noticed that there are quite a large group from the pharmacology, from the University of Pharmacology Medicine, or is it medicine? Anyway, both together. I have experience of working with pharmacology courses who do PBL, and it works very well. It's a good match for pharmacology because you have the basic science but also build it into the clinical, which is good. So, although we've spent a lot of time on that exercise, I hope you feel that it's been worthwhile just to get a sense of who you are as a community. We will now continue.
Also, it helps when you're doing a PBL to have that sort of introduction because it actually breaks down barriers and it helps you work as a group. So what I'd like to do today is I'd actually like you to do some work for me as well today whilst I'm telling you all about active learning. I need the screen on. Turn the screen on. Just while he's doing that, what I'm going to talk about today is there are two sessions. The first one is what is active learning. The reason why I'm calling it active learning is because, as you heard this morning, there are many different forms of practice for active learning. There's problem-based learning, there's case-based learning, project-based, task-based, and it goes on. But what we're going to talk about here is just plain active learning. So what is the basis for PBL is in this talk. And I want to step you through it in a very slow way so that you can see how you, as a tutor, can implement it. I found that some of the terms, when I was looking at it, I thought, well, what on earth does that mean? And that's what I hope I'm going to be able to give you, is some of my experience and my way of navigating it. The first slide I'd like to put up is something that everybody talks about. There's a difference in cultures. But really, this saying, which is very old, aligns with Socrates as well. So, I hear and I forget. Thank you. I see and I remember. I do and I understand. Active learning is like that. We have to do it. We can go away and we can be told what to do. We can see what to do, but we don't really know until we get up there and do it. Now, as a PBL tutor, you're going to be leading by a positive example with this. So, underpinning it is a lot of learning theories. Now, just a bit about me. I'm a PhD student in the Prideaux Centre. Julie is my supervisor, and Professor Schuer is my other supervisor. What I had to do when I first started my PhD was understand how we learn. And so I went through all of the learning theories, and what I'm going to present to you today is a combination of my understanding of how we learn, which is what I use for the basis of my research in my PhD. Yeah, which is about active learning. I should say that, yeah. My PhD is about active learning and about how we are learning with what everybody's got in front of them at the moment, the information communication technology. So how are we learning and how are we cognitively putting it in here and not leaving it on our laptop or on our phone? So that's my research. So active learning also has a lot of metacognition, which means how we think about how we think. And so it's can be meaning directed, and it's not limited to a prescribed amount of material. So it can be whatever stimulates us. The other thing that is important in this is learning. We have to remember things. And so how do we form long-term memory? And how are we processing that information into memorable knowledge? Now, I've heard somebody say to me that knowledge is always memorable, but this is in a different way. We have to be able to recall it when we need it. As educators, we need to know about active learning to assist in educating our students, but we have to practice it ourselves. This is my very complex diagram. I'd like to step you through it. So my theories have been from Albert Bandura, whereby he looks at the environment in which we live in. And the environment interacts with our behaviour. This is the public world, this is what we all see. But then the personal world is what I'm actually interested in my PhD, is the interaction of the personal world, of course, with the IT that the students are using and the behaviour. But here we've got a model by Atkin and Striffen, which is looking about how we have input of information, which is what we're doing, we're seeing, we're hearing. Then we have to attend to it, we have to perceive what's necessary, and this is our working memory, which has got a limited number of information that we can keep in it. We want to be able to get lots of bits of information that we are meaningful and in context, so that we can put it in chunks in long-term memory. So when we see a problem, so if you see a patient and there's got a problem, you want to be able to quickly recall that information into your working memory and have new information coming in to then encode and make new memories. So this is the basis of active learning, in that we need to be able to enhance this. This is one of our, I think you might have seen this, Julie might have had this diagram, this photo up before. This is a typical PBL room at Flinders. We've got students sitting around, they've got all of their information that they need in front, they've got their laptops, they've got some pieces of paper of what they've got their information on. They've collaboratively worked up on the board, got information up there, and they've got the information about the case on the screen. So I want to break down active learning into what I call tenets, which are the basic principles of active learning. The first one is the 3 C's, I call it, and then we've got self-directed. So we've got construction of knowledge, we've got collaborative learning, contextualised learning, and then we've got the self-regulated learning, which of course isn't a C. So these are the principles that I want to work through with you, because I first of all thought, how do we construct knowledge? What is it? How do we do it? And how do we encourage our students to do this? So I've got this back here just to show you a little, just to recap what we're doing. So this is where we've been. This is what we're doing today at the moment. We're listening in a lecture theatre, but it's not going to mean that much. We might see things, but it's still, we might not remember it all. But when we get up there and do it on a board, in front of everybody else, and we have to tell you what we understand about this problem, it's a really different level of knowing. So, yeah. I heard this morning that your dean talked about rote learning, and so active learning can't be about just remembering things. You have to be able to put it in context. So we have to be able to explain it to others and organise the information in our own words. It's a different, as I just mentioned, different level of knowing. And one of my learning theorists, Bandura, talks about rehearsal and performance in context. And then, to understand the problem, we need to be able to think laterally, because not all things are in a simple path. So as students, we want to encourage all of this. So what I'm going to do is I'm going to show you a little scenario in a minute, but I'll talk about the scenario just a little bit about it in the first place. The role of the scenario is to make the problem in a context. It's to increase interest. It motivates people because it's of relevance to what you're doing in your study. It's chunking the information so that we can put lots more information into our memory. It improves our recall because we can pull those chunks and many chunks back into our working memory. The long-term memory is enhanced all the time, and it is always available to our working memory. So here again, I'm going to go through my steps again. So construction of knowledge, collaboration with others, contextualisation of information, and self-regulation. Okay. First of all, I'm going to go through, I'll go through how we construct knowledge. Next one. So this is where I really struggled when I first started thinking about it. You know, how do we actually construct knowledge? Now what I want you to do is to think about all these points that I'm going to put forward. Then I'm going to give you a scenario. Then I'm going to want you to think individually about this scenario. So brainstorming. Everybody's heard about brainstorming, but does anybody actually know what brainstorming is? Does everybody have a concept of how you brainstorm? Yeah. Yeah. Anybody else? Well, it's activating your prior knowledge. Now, even a little kid can have prior knowledge. Even a 10-year-old can have a prior knowledge. And of course we call our elders very wise because they've got lots of prior knowledge. So no matter what age or a student can be, they've got something there that they see from their own perspective. So, you know, I'm looking out at you here, but you're looking at me from a different perspective. This activation of prior knowledges and experiences is what makes each student unique. Makes the tutor have a very, quite a remarkable opportunity to be able to see how others view the world and what their prior knowledge is. So once you've got this prior knowledge out, you look at the problem, the scenario that we've got, and you try to understand, use that prior knowledge to understand the problem at hand and apply it to it. Okay. Then you look at why that's occurring. So we want mechanisms, we want to understand why this is happening. What do we need to know to understand what is happening underneath? So one of the first things I say to my students is that, one of the things that I say to my students is that to be able to understand a problem, you need to understand what is normal. So recall all of that information that you have as normal, and if you don't have that, then that needs to go as a learning issue for those students. So mechanisms is what I consider one of the key things that students need to be able to do. There will be things in the group where students will say different things, and also there will be conflict in individuals' minds. This is called cognitive dissonance. That cognitive dissonance is a driver for learning. So by being able to identify and acknowledge this tussle inside, students will be able to start to self-regulate their learning and think, well, what do I need to know to understand it? And then what does the group need to know to understand it? And then it's evaluated by the group. And this is the important point. After all of this, the construction of knowledge really does start where, best of all, when you still don't know. That unknown, the role of not knowing, is the key. And I think that in clinical situations, it's really important that people acknowledge that they don't know and that they will seek that information. And from an early stage in problem-based learning, they're given that permission to say, well, I don't know. Do you know? No, let's go and look it up. And know and have strategies to go and resolve it. So that is the identifying of the learning needs. Here's my scenario. I was getting panicky that my scenario was not there. Now this is a very simple scenario. I'd like you all to think to yourself, first of all, what you think is important. So we want to identify, we're going to do the PBL process here, we want to identify key information. So what do you consider, thinking to yourself, what do you consider is the key information about this scenario?
Would it help if a student was to read it out loud?
That would be great. Would anybody like to volunteer to read it out loud? The reason why Julie's asking that is because in the group it's important to have everybody on the same page. You can all read it through at a different rate, but by reading it out loud it means that you are all following it at the same time.
So I'm from a student.
Thank you.
Okay. So when I get this problem, my brainstorming is something like
Just read it out. That's what you have to do.
The scenario: 30 years old female present with a 12-month history of intermittent excessive sweating.
Students?
Now you've got other bits of information there. You've got a photo, and one important thing is having a photo gives you a little bit of a visual clue as well as what's written there. So what I'd like you now to do, as you've had a little think about it, I'd like you to talk to maybe a couple of people around you and see what you think about what you think is important information in there. So can you do that just for a little bit? Think of what are the key points, and then I'll ask your group what you thought were the key points. Okay?
Just take a little minute, talk to each other.
Sweating. Excessive sweating. Thank you.
What else is a key bit of information?
The case is excessive sweating, 30 years old, female, 12 months.
12 months. Okay, look, that's fine. Now, because you've all come from different backgrounds, you'll all start to think of what could possibly be causing this. Now, you've got a huge range of backgrounds here, and I know that you've got a lot of different specialties. So what would come first to your mind as a differential? Keep that to yourself and then talk to your people around you.
What could this be? It doesn't have to be a diagnosis. It can be a mechanism. It could be a hunch. Do you know the English word? Oh, I think it might be something to do with skin. Now, share with the people beside you. Have a conversation in pairs.
Okay. Let's have some information. Just call out what you think.
recognition disorders the relation to autonomic system and maybe some adrenal gland. Yes, maybe not adrenaline or no adrenaline. Yes, I think.
Thank you.
Yeah, I think it's a hyperhidrosis, maybe due to the thyroid function.
Thank you.
Maybe hyperthyroidism.
Thank you.
Maybe she has a tumor that secretes a substance to enhance her sympathetic system, nervous system.
You've given us some really, really good examples here. Now the next step is to work out, to justify it, is to start talking about what is the mechanisms underneath it. We've got a condition here that's abnormal. So how do we normally, how do we normally sweat? What is the normal control? Because we all do sweat, but what is the normal control of sweat? And why are these conditions that you put here going to cause an abnormally excessive amount of sweating? So you can see where I'm heading, can't you? So this activation of your prior knowledge is going to be challenged. At Flinders we have students who come into our problem-based learning courses who have PhDs in immunology or other major fields. They come in with a very vast amount of knowledge, but to be able to put it into a scenario and use it in a different way and be able to unpack that information in a different way is a challenge to them, but it's the role of the tutor to encourage that, to get those pearls of information out of those students. And then the next part I'm going to talk about is how you can then collaboratively construct that information together. So we'll come back to our scenario. So we've done the brainstorming. We have thought, we have to think basic, normal anatomy and physiology of sweating, and then the when, why, and what can go wrong. So you've given me some hypotheses, but then we have to break that down further. So collaboratively, to break that down further, we're going to share that information with each other, share our knowledge and our understanding. So if this was my PBL group, I would not be standing up here. I would be getting my students up at the board, and I would have as many boards free for them with my trusty selection of coloured pens. And I would get them up there drawing diagrams, drawing why they think these hypotheses are important, but also what is, as I had before, the basic anatomy and physiology of sweating. So I try not to let them assume any of the knowledge. They have to go back to what I call primary principles. That way, everybody in the group can start to build their knowledge at a similar level, but also have people who have got different prior knowledge, bringing it into the group to enrich it. So, this is the point that I find very, very exciting as a tutor, but very challenging for the students. Because when they get up and try to tell people what they know, it's very different from sitting down and writing what they know. By explaining it to others, you're getting to a different level of knowing. So that rehearsal of that information can actually be quite challenging because you're putting that knowledge out to others for others to critique.
but by putting it out there, you are enabling others to help you refine that information as how you understand it. So by rehearsing and explaining it to others is a key role. If, as a tutor, somebody came in and said, I didn't understand how sweating occurred, and I said, well, it's this, this and this, my students would not have a deeper understanding of it. And if there's other conditions that can be causing abnormal sweating and they didn't know the basic understanding, they might miss it. So by understanding, by primary principles, they are learning themselves. They are constructing their own knowledge together. They are rehearsing it together, explaining it together. And I say digesting that information. So then it becomes part of them. The other part of the explaining is the discussing with each other, but it's important to listen and to question. Now, as a tutor, Julie's already said that we are like a duck sitting on a pond, but underneath we are madly, madly paddling, because we are listening carefully to what everybody says, and as a tutor we try to mentor a role of listening and questioning and hopefully directing those students in the right way. By doing that, we are encouraging our students to do that. And so our students together, collaboratively, learn how to discuss and listen to others and question. Those are key roles, I think, in the critical thinking and clinical reasoning. Out in the workplace, there are so many different people all the way around, and everybody's got to learn to work with each other. This is what I consider one of the offshoots of PBL, is that they all learn to cooperate. By cooperating, you have to cope with people who are quiet, who are noisy, who are all sorts of people, and that is the workplace. They learn in a safe environment how to communicate with each other on a very respectful level, and they learn how to participate together. And so when they go out to the clinical, they are actually have a lot of strategies on how to cope with working with different sorts of people. Hence the team communication skills. So we've done a little bit of the brainstorming and hypotheses, but as I said, what I would be getting next is for each student, each group, to be justifying why they were doing it, putting it up on the board and describing mechanisms. But the next point is about further information. So how are we going to work out the differences between these hypotheses? So then the students would start working together again to work out which one they think is possibly going to be the major ones. However, we've only got this small amount of information, so they really haven't got much more information to go on. So they want further information. So just quickly, what further information would you like? I'm not going to give it to you. Just call out. Physical examination? Mm-hmm. Anything specifically that you would like?
About the history of the symptoms. Yeah.
So a timeline.
The time of sweating. Is it occurred in the morning or in the evening, or maybe when her working or when her relaxing? Yeah. Is this related to her more to her psychology problems or not? Yeah.
Absolutely. You've just raised another learning another hypothesis. Because you've said about her, maybe there's some psychological component here.
Yeah.
Thank you. So we've got physical assessment, we've got history. So we can start asking for other things. Now, if we suspect from that there might be some other, like we've just had, if we suspect there might be some other hypotheses, there is nothing stopping those going up. What will happen later on is that you'll then prioritise those, and then as you get further information, it is progressive disclosure of information of the PBL process. So the next one is about contextual. Now here's another PBL group. This is one of the groups that I studied in my PhD. And I was very lucky, I had 4 cameras around so I could look at what everybody was doing. But this is a particular case, and you can see that on the screen, is a man lying on a bed, and he's in a sleep lab. So he's actually got belts on his abdomen, belts on his chest, he's got a face mask on, so he's having his oxygen saturation levels taken and everything. You can see also that he's slightly obese, and he's asleep, he's sound asleep. And so this video that we show our students is about his sleep apnea, so how he stops breathing in his sleep at night. All these students are absolutely riveted. What I mean by that, they're just glued to the screen. And when I videoed this, all of them held their breath when he stopped breathing. The students still to this day remember this case. They remember the associated respiratory examinations that go on. They remember how we breathe. They remember the biochemistry. They remember looking at polysomnographs of where his sleep, his brain, because he has an EEG on as well, so his brain waves. They were totally riveted. Absorbed, sorry. Please tell me if I say a word that you don't know. But it was, because I videoed it, this man stopped breathing for 2 minutes in this, and all of them started to, need to breathe towards the end of it. So it was quite significant. So in your creation of the PBL cases, having a video can actually help the students as well as all of the associated information around. They've always told me that they never forget that one. So, the other important thing is that even though they are contextual, and this particular respiratory case was really quite complex, because these cases are specifically written for the students at their particular level of education within the medical course, you actually expect them only to get to a certain level. But then when they come back to it, say if they see it in a clinical situation, they can develop on it more because they've chunked that information, they've brought that back into working memory. They then can learn more from that clinical encounter that they had. Or sometimes throughout the course we will have a case that develops on a case that develops on a case. So it's that your spiral curriculum touching on bits as you go along. And each time they pull that information back out, the contextual component helps that being pulled out, and then they can grow further and learn more. Contextualisation makes it interesting, it motivates them, and that memorable long-term memory means that they can pull it out in big chunks. So now we've got our lady again. So the contextualisation of it was, if we could actually have put this lady as a marathon runner, but it wouldn't fit with her 12-month history of sweating. We could have her as a lady who is very highly stressed, and maybe she's had some life events. You know, we can contextualise all of this by adding on that story for the students to be able to learn. So after the construction, the collaboration and the contextualisation, the students are then at the same time, they are becoming self-regulated learners, and everything that we do is responsible of the student. So it's a student-centred approach. The learning is according to their needs. So they are looking at what they need to know to understand it, and then when they come back collaboratively, they can share that. It's about learning forever. We don't just stop learning once you finish university, you just keep going. And it's like steps, we always step through. It's comfortable in not knowing, that's a safety thing. And strategies for resolving that unknown. So how do the students resolve them?
Jill, I just wanted to ask about the comfortable not knowing. It's not comfortable with being ignorant, it's about comfortable that actually nobody knows. That there's the edges of knowledge. It's not just I don't know it, but nobody knows it. And students are surprised to discover there's stuff that nobody knows. Then they get interested in research.
Yeah, that's true, that's true. Thank you. So the next part of active learning is not just the presentation and the first tutorial, so we call it, of the key information, the hypotheses, further information, and then developing what you know and don't know. The next part, which I find really critical, is where we try and get the students to co-construct their knowledge, and that's the report back. The report back is one of the most interesting parts of it, and a lot of students, and I find a lot of tutors, like to shortcut it because they think that it's just, regurgitating information. So in my tutorials, what I like to do is have a blank board when students come in and they're learning issues. They will come in and they will co-construct them. So they can't just have one person go up and say, I've taken learning issue 1, I'm going to put it up on the board. What they do is I get one person to maybe conduct that learning issue, but get others to give their information, because each student have gone away and looked at different resources, and then they can come back and put that up on the board. Most of the time there might be some lectures associated with it, so they've got a level playing field there, but then they go away and look at different aspects of it and co-construct. Now, you can't really see this, but this is a acute renal failure flow chart. I quite like flow charts and concept maps in putting things together, and I would say this is like an overview at the end of a report back. And I would say to the students, it's like having a drawer that you can pull out each component of that flow chart, and you can explain to me the mechanisms, the pathophysiology, everything within it. This is the end result of a good co-constructed report back. Students go away thinking that they're really quite, their head is just burning because they have been working so hard, and that is a good report back. With co-construction, that was the other thing that I found was important to break down, is that it's important to note that everybody has a different frame of reference, so they've come from a different background. There's many prior knowledge, many research, the different aspects of the unknowns that they went away to look at. Then they've come back, they've digested that information, so there are many explanations of it. And this is my rich soup that they come back with. and it's very good. It's good for you. So just basically, just to break it down again, is the basic steps that I've really pared it down for you for active learning is construction, collaboration, contextual and self-regulated. I think that's it. This is my fun slide. Have you ever seen this slide before? Yeah, it's a very famous one, isn't it? Yeah, sorry. What I like to do is I like to just ask you, what do you see? Who sees a young person? Who sees a young woman? Yeah, thank you. Who sees an old woman? You see too, because you know. Yeah, this is what I like to show because everybody has a different way of looking at things, and there are some puzzled faces. Can you see the two different ones? Can you see the young and the old one? Yeah. I can explain it later. But it is, I find this is a good one because everybody does have a different view on the same image. That is what makes a PBL tutor's life wonderful and exciting, because the students are our inspiration, and I've always found that as a PBL tutor, I sit there jotting down notes. Oh, that would be good to research. That would be good, and I learn, and I just wish you the best with it. I think at the end here, I've got my diagram again. I've got a couple of pages of references, if anybody is interested, and I'm happy to take some questions.
Questions? Anybody have some questions at this stage? That was a very fast Cook's talk, but tomorrow you will actually get to enact this and go through it more deeply. Now, we have any questions? No one has any questions? Yes, there is a question.
I just have a small question. As I realized that BPL based on the active learning, active capacity learning of the students. So what if they are not active as us respect? Yeah. What if they didn't prepare well for the lesson, for the knowledge, for the searching for information before the PBL classes? So what if we we invite them to join our lessons, our PBL classes, but they don't have any ideas about that problems? How can we manage that? Yeah.
That is what the practical part of this workshop is going to be about, is how to do that. And we've actually got another a presentation on it. But it is so important that students do participate. And at the beginning, like we've just done it, we did an introduction of everybody, but then what we would turn around and do to the group is we'd actually talk about some ground rules of the group. They have to participate, they have to be punctual, they have to prepare, they have to respect, and they have to always be polite. So we have those as basic ground rules at the beginning, and usually the students develop those themselves, but as a tutor you can suggest them as well.
I just wanted to pick up on one of your assumptions that the students have to prepare. PBL is a problem-first method. So it means that we are making an assumption that they have some kind of prior knowledge. We are used to thinking as teachers that students are like an empty bucket and we have to fill their heads. But none of you were empty buckets before you came here. Your heads were full of all sorts of experience. Even if you'd never done PBL before, you might have heard about it. You may have done some active learning before, you may have some ideas about learning, etc., some experiences. So if we were to run a PBL, and we nearly did this, but we decided it might be a bit challenging, about, how we give you a PBL case. How can you be a PBL tutor? Okay, so some of you might have no idea, but some of you have a lot of experience. Okay, so it's a problem first method. The place where it might fall down is where the students are very, very young and haven't yet done any science. But most students coming into medicine have done quite a lot of science. They can bring a lot to the tutorials. The thing that sold my school on PBL was we had a group of PBL students come from Newcastle University. They flew over to Adelaide with their tutor, and they did a PBL tutorial in front of an audience of about 300, okay? Like we called it a fishbowl. They were second year students. It was a complicated clinical case. And after about an hour of watching the PBL tutorial, clinicians were getting increasingly excited. They couldn't believe that students in the basic years with a fun, just no clinical experience whatever, could build up such a knowledge about this case. They were really astonished. Okay, so I just wanted to challenge that fundamental assumption that they have to prepare. When Jill was talking about preparing, she meant for the report back. Yeah, the report back. For the report back, which is the second big tutorial. Does that help? Yeah.
I have one question. In situation that there's many opinions from students, and there's a conflict opinion, and that some knowledge today is right, but tomorrow maybe it's wrong. Yes, wrong. Yes. So now how to solve this problem? We can say that you're wrong, but tomorrow's they're right. Yes.
I think that's the important thing, is that we have to be able to be adaptable and also acknowledge that what we know today will be something different tomorrow, and because our environment is going to change within which we learn.
We know that our knowledge is out of date the minute we graduate from medical school. That's why we are continuous learners. Anyone who has had a career in medicine for 20, 30 years knows that what they know now is completely different to what they knew in the beginning. The interesting thing is always to ask that question, how do we know that? Where did you get that information from? To question back about that. So sometimes students, we have designed a case for them, okay, on today's knowledge. And a student comes to report back and they've read Lancet or New England Journal of Medicine, and they say, hey, this is out of date. And we go, fantastic, tell us about it. Share your knowledge. And as tutors, we go, great, I'm going to read that paper after the tutorial.
The next session that I've got coming is actually working you through a proper case. So I was going to step you through a proper case with all of the cues as well. So the fact that we've written bits and pieces up here is a rehearsal for what you're going to do next.
So I think we've got one more quick question, but I think then there's afternoon tea.
How do we know how many hypotheses are enough?
Well, as a tutor, what we want them to do is that we have learning objectives which are set as part of the curriculum. So we want those students to be able to make sure that we get there. So we have to be able to question them, to ask them about what is important up there. So to start off with, they could have a long list, but they will be just brainstorming them. And then we'll start to ask them, well now, we've got a bit more information. What further information do you need to be able to do that? And as a tutor, if they're still going on, you might ask a question about, because you've been listening to them, you might ask a question and say, well, this is a young lady. Some of these things might not be appropriate for a young lady. And then they'll think, oh, and go back. So as a tutor, I say, I'm being very Australian here, I say I'm a sheepdog. Now, I don't know whether you know what a sheepdog does. We have lots of sheep in the paddock, and the dog, we say, go and round them up. And they're very, very skilled at rounding the sheep up and getting them to go through a doorway just like this. So I say I'm a sheepdog. I try to round up my students and keep them on the right track. They will stray, and that's good for them, but then I'll keep them back in.
Can I just add one thing? Sometimes it's the opposite situation. Sometimes the students come up with one hypothesis, and sometimes that's because the previous year students say, oh, you know that case, that's about blah. Okay, so they say. So they may say, oh, it's hyperhidrolysis, okay? And as a tutor, I just say, well, that's fine, but what else can it be? And I keep pushing, what else? What other systems, produce sweating? And sometimes I may say, let's think about the normal mechanisms of sweating. And then they start to go, oh, it could be neurological, oh, it could be psychological, etc., etc., etc. So you push them, okay? How much is enough? Be guided by the case. You have a tutor briefing before you do the case, and it usually has a list in the tutor guide of the types of hypotheses we're looking for, so you can push them for that. Does that help? Yeah. I think it's... Oh, yeah, just
I think that's in the BBL class, we should have the student have the same background or the same levels.
Yep.
Just because because that the student not bring the empty buckets,
that's
so
right.
Maybe they will have very rich knowledge, and some student has poor knowledge.
Yeah.
And when we get the BBL, the student feeling that I understand all.
Yeah.
Yes, and they feel boring. How can we manage this?
We do get quite a few students who say, I know that. I just know. And if I give you a particular student that comes to mind, is that because we're graduate, this man was a veterinary scientist, and so he had been an accomplished vet for many years. The question that was raised was about fever, and what is the significance of fever, and how is fever controlled? And he just said, oh, I know that. And so I said, okay, show us. And he got up and he started saying, oh, don't think I remember it. And so I then asked him to ask some questions. What do you think you need to know to remember? Because I think one important thing is to help students maintain their face with other students as well. So, respect. I had respect for them. And then I turned it round and I said, I know that you've got lots of knowledge there, but maybe you can question and let's unpack that problem. And he did, and afterwards he came to me and he said, well, thought I knew that, but I'm going to have to go away and do some different work because it's in a different context to what he was doing before. So I think it is important to be able to challenge those people who say that. If people really do know all about it, I use them as, instead of me being the questioner, I'll say, okay, my background is immunology, clinical immunology, so I'll say, if it was me, I'd say, well,
that person with clinical immunology background, let's you question the students about their understanding of, say, B cell development, something like that. And so I'll hand the baton or hand the role to them to ask questions of the group. That way, they can demonstrate their knowledge, save face with their knowledge, but also not lecturing the students who don't have that knowledge, but they are guiding them. And that works wonderfully. Does that help?
Yeah, so, I mean, so many questions. We've got 2.5 days, but there is afternoon tea out there. Have a little break and we'll come back. We're going to take you through a case and then we're going to talk about the role of the tutors so that you are ready tomorrow. Tomorrow you will firstly experience being a PBL student in small groups, and then after that you will experience being tutors with real student groups. There are student groups that we haven't met yet, actually, so I think interesting. It's deliberately, we make it deliberately problematic in the tutor training so that all the issues you need to deal with come up when we problem solve them. It's not a problem group who's going to make it all work magically for you. Yeah. Okay, so afternoon tea. And I'll spoke to you first.
Steve Dalton. And this is the picture that's associated with them. So all information that is given in a PBL case has some form of relevance. So each piece we want the students to make sure that they acknowledge it, they jot it down on a piece of paper, or they put it up on the board. So is there any bit of information that you want to put up about what we've got now? Yeah. I've divided the board up. Now some tutors don't do this, but I quite like this, and I felt that it was appropriate that I show you what I do so that you can choose to do it or not.
I can do this. I'm all free for it.
Yeah. But I like this way because it keeps the information tidy on the board. Oh, thank you. So, Julie, can you put up some headings? So, does everybody remember what the first heading was? Key information. This is very basic. Key information. So what key information can you get so far? Accident. Motorbike accident. Yep. Anything else that might need to go up there? Yep. No helmet. Very good. That might have been my selection of a Google diagram. The other part is his name. Goes up. Yeah. And he's a he. Okay, now I'd like somebody to read this out. This is the first slide. Now we're going to be getting key information, and I want you with somebody to read out, so we're all reading it together. Would anybody like to do that? Who feels comfortable?
In this case, Steve Dalton, a 20-year-old motorcycle courier, is brought in an ambulance to accident and emergency following a traffic accident in which he came off his motorcycle. He is conscious and complaining loudly of pain. When asked Where it hurts, he indicates the right side of the neck, right shoulder, and the lateral aspect of right arm down to the palm.
Thank you. Now, there's a lot of information in that. So what we want to do is break it down. So would anybody like to call out from the first paragraph, first bit up the top, what is key information that Julie needs to write up? Julie's a student, so she's going to be collating your work. So what's key information in that first part? 20 years old, thank you. Traffic accident. Motorcycle, so we've got those up. Anything else? Do you know what a courier is? Do you know what a motorcycle courier? So this person's job is a courier, so he transfers information and things. So, and he arrives by ambulance to the ED. So he's not just had a little nick of his knee, he's looks as though by ambulance means that he's quite sick. What else? The next paragraph. Conscious? Pain. Anything from the next part? So you can put pain. Yeah. So this is where you start to develop like a tree diagram with things. So we've got pain, it's in certain areas, so you can put that along there. Now, is there any part of that that you don't understand? Now, I know that you're all doctors and have experience in this sort of thing, but think very basic. What sort of things are in there that you think you might need to understand or question each other about? So you want to know the man's blood pressure to see whether he's okay. So in fact, because he's coming by ambulance, you want to do his vital signs to see that he's going to survive us doing this. Yeah. So that's good. So you've got a priority, don't you? Yeah. Anything else? Broken bones, yeah. So now we're going. Well, that's neat to know. Yeah. But what happens is, something like this happens, in a PBL we don't necessarily all go down on the one path. Like you've now given me a potential hypothesis that he's broken his bone. My supervisor. So a hypothesis can be that he's broken a bone. Whilst you're brainstorming, all these things do come out. You know, what do we need to know to understand this problem? Is there anything up there that we don't understand? All of these things do come and bubble to the surface at the time. But as a tutor, you will then turn around and say, well, that one is actually a hypothesis. Muscular damage. Are we looking at any particular part with a fracture and with muscular damage? Okay, so why did you say nerve, cervical nerve?
Because of the symptoms and the size of the patients, he has indicated that the pain of the right side of the neck, and then the right shoulder, and the lateral aspect of the right arm down to his thumb. Yeah, and I imagine that maybe the cervical nerve can be affected because of his trauma.
Okay, so how does that
caused the pain? How can he be feeling that pain?
Maybe I can feel that he have a persistent pain because of the injury of the nerve, and the causes of that pain is that he has cervical
Okay.
spine, yeah,
Yeah.
spine trauma.
Yeah. Okay.
Infection.
Yeah. So, if I was to look at the underlying primary principles here, what is pain? How do we feel pain? You've told me that there's this nerve that goes down this arm, and it's a particular nerve that has particular areas. So, as a tutor, it's really important to be able to break it down, because you have got knowledge, you know what you're talking about, but I want you to I want the students to tell me underneath, how do we know, what is that pain? How do we feel pain? What is the transmitter of that pain? So can anybody give me a quick rundown of that?
Write it on the board, on we say it out loud or write it on the board.
Yes, that's right. Because we've got a big group here, that we won't get you to, tomorrow we'll get you to write on the board because you'll be the students. But that's right. If you wanted to, you're more than welcome to come up and do it, but I don't think we've got enough board space, have we? But you can. But that's the thing. If somebody came up and said, well, I don't really understand how the nerve, how pain is transmitted on a nerve, and then what is a nerve, and then what's the structure of the nerve, where does the nerve go, and everything. That's what Julie was writing down here. That's my need to know box down here, Julie. Down here.
I call that learning issues.
Learning. I say it's need to know. Now, the reason I say it's need to know is because as you go on in the tutorial, somebody might actually come up with it and say, oh, that's such and such, and then they'll cross it off. Or they'll say, we need to develop it, and then they'll have a couple of points down here, and feel free to put as many points down here. And then at the end, they'll work out their learning issues by combining some and refining what's written in there. Good. Very broad, isn't it? So what else do you think that we might need to know, apart from just plain pain mechanisms?
Differentiation between pain caused by the nerve damage and muscular damage. Differentiation.
Yeah. Yeah.
I think the big problems in
Actually, I think the big problem is the approaches to the multi-organ, yes, to the multi-organ trauma, the way to approaching after multi-organ trauma. Yes, because pain is the symptom, but the major scenario in this problem is the after the accident, and we must do a way to approach the multi-organ.
all right.
I know what you
systematical.
Yes, so you are speaking like a true clinician. You see, what you're saying here is what I want the student to be able to do is to be at the door to do a primary survey with my motorbike accident. That's not the purpose of this PBL. This PBL is about pain mechanisms, and these people are learning about pain mechanisms in the context of an accident. 2 years later, in this same course, They do the multi-trauma. It's a clinical year, surgery, multiple trauma, primary survey, secondary survey, all of that. So where would the students go with this and how we guide them depends on the purpose of the case. Yeah, but this is one of the tensions for clinicians. They jump straight to, what would I do? Oh, I know, I've got to treat this like a multi-trauma, you know, I want to stabilise his cervical spine, you know, get him on a board and do the primary survey and, you know, do everything, you know, ABC, In the surgery case, when they do it in third year, that's when they do that, same thing. In that particular case, it's someone falls while abseiling on a cliff. Okay, and they fall a long way, and they have, you know, unconscious, you know, and we do the whole thing. So it's what the case is designed to do. It doesn't always follow the most authentic path. In this one, this is a first year case. The students are actually just thinking about what's the mechanism. The focus is different. Yeah. Does that make sense to you? Yeah. You worry that they might model bad medical practice, don't you? Yeah. It won't. It's okay.
Yeah, it doesn't, because the students are only at a certain level. They only have. It's one of the learning theories, Vygotsky, has the zone of proximal development, which is students are in. You teach within a range of what we know the students are able to succeed in, but push them a little bit so that we don't overwhelm them, but we keep them within their own zone. And this case has very specific learning objectives, which I'll show you at the end after we've worked through. And we'll see whether we've managed to achieve those learning objectives in this session. But the cases are specifically written to explore aspects of the curriculum, not all of them.
I would like to add though, we have many paramedics come to do medicine. So the paramedic student would immediately jump to exactly where you went. But that's fine, we then work with that. We then push them back and push them back. And our paramedic students often go, I know what to do, actually I don't know why. I don't understand the underlying mechanisms. I've been trained, but I haven't had the deep understanding. So,
because they're now in a different context. They're working in a different context and have to understand it from a different perspective.
I'm sorry, but I think this is not suitable scenario to approach the pain, because this is the really accident, and when you reverse the scenery, student can miss it because the victim is still conscious. But it's very dangerous if he's into hemorrhage.
So it's a lucid interval.
Yes.
Yeah.
And when the admitted to the hospital, yes, he didn't complain to the head pain. Yes, but he was a severe accident. Yes, and fall down to the street. Yes, and they can steam table can cause the student miss the dangerous. Yes.
Okay, so this is why a PBL curriculum needs to be constructed by year. This is a first year case, not a sixth year case. If this was a sixth year case, it would be all about management. But this is not about management. First year students are not up to management. They're up to learning about the physiology, the pathology, that kind of thing. I do see what you're saying.
Could I comment in Vietnamese first? Chắc nó sẽ nói tiếng Việt chỗ này. Chắc các bạn xin lỗi em á. Thật ra những cái ý của cô á, không phải là cô đang hướng dẫn chúng ta tiếp cận bệnh nhân này như thế nào. Mà cái cô đang ví dụ á, cô đang ví dụ là để cho chúng ta hiểu rằng cái tiến trình làm BBL mà chúng ta đang đóng vai, chúng ta là học sinh sinh viên á, đang tiếp cận đúng như theo hướng cô nói. Chúng ta đang thảo luận về chuyện là ở đây chúng ta đang tiếp cận bệnh nhân để theo cái hướng đó, thầy cô cũng thích như vậy.
Lý do là vì em cảm nhận cái tình huống này đưa ra nó
vì em nghĩ rằng là nếu mà cái tình huống này á, ví dụ như đưa ra cho sinh viên năm nhất, năm 2 chẳng hạn đi, mà mình tiếp cận một bệnh nhân theo cái hướng là cơ chế bị đau hay gì đó, thật ra nó sẽ gieo trong đầu sinh viên những cái ấn tượng về cái sự tiếp cận nó
không ở đây chưa có nói tới cái vấn đề tiếp cận bệnh hay gì hết. Ở đây đang nói thế này, đầu tiên là chúng ta phải làm sao để contract knowledge, đang trong cái bước đó thôi. Nghĩa là đang làm sao từ cái vấn đề đó cô mới đưa ra được là bây giờ đến vấn đề này sinh viên phải tìm hiểu những thông tin gì, đang nói cái bước đó thôi, đang cái bước đó thôi, đang mới chưa đi đến bước đó. Thành ra bây giờ cô đang là tới cái vùng mà đang xác định những vấn đề cần phải biết, đang chỗ đó. Sorry for Vietnamese.
That's fine. That's fine. We are very happy for you to have conversations in Vietnamese. And what we just witnessed is active learning, debate, co-construction, confusion. You know, there are some concepts to be learned here about PBL, and it's confronting. There is a confrontation, but very carefully resolved. I think we need to hold on to your concern. I think you have an important concern. Let's keep going with the workshop and see how we work it through. Okay?
Because I missed your idea because I think in the first, you didn't give me the topic we to discuss. Yes, and you give me a trigger. Trigger. That's
And the reason we partly do that is exactly to provoke this sort of conversation. You have just made a very useful contribution to our workshop. These are the issues we want you to work through. So you have done the right thing, not the wrong thing.
And it's so valuable to be able to express your concerns over this sort of teaching. So thank you.
I think we need to know about pain mechanism to focus, and find out where it's going wrong. Some organ, when it's going wrong, it has some symptom, specially, it's special for this. So if the student know about pain mechanism, they can find out the organ go wrong.
That's really good.
Yes. I think like referred pain, you know, that sort of thing.
Well, I think our body has pain receptor all over the body, over every organism. So when these pain receptors are stimulated by some kind of injury, for example, in this case, then the stimulation is transferred through the receptor and the nerve to the central nervous system, and then we feel there's something wrong at that place. If it's some kind of direct stimulation to help the body know where's something wrong. Another case is those receptors are stimulated because of an injury somewhere else, but they share the same pathway to the central nervous system. It's a referral pain, like you have mentioned.
Yes.
That's all I remember from my years.
That's really important, because now what you're talking about, we've got, as Julie said, when we put down the need to know, we put down pain mechanisms, but we're actually now talking about pain pathways, aren't we? So we're talking about what is the underlying anatomy of this system, which is basically we're looking at the nervous system. And so we're going to try, the reason, as I said, why I put it as a need to know, because when we actually go to the students going and doing self-directed learning, they'll need to be able to refine those issues. And so by discussing further, we've heard that there are now pain pathways, there are now receptors in there, there's it involves the brain, so we can actually start to make these learning issues something that they can achieve in a couple of days before they have to report it back. So that's, as a tutor, we will be doing that.
So I've just added on need to know just because to bring the conversation there. Anatomy of arm nerves, anatomy of spinal nerves, and it may be that associated with this class there is an anatomy lab about exactly this.
Yes.
Yeah.
Now I'll just go on. So now what I've got here is just an example of, as I said, we're going to do a work design. You've done it here, but I just want to recap on how we could collate it together in another way. So what I've got here is what our group would have done is exactly what you've got, boarded by ambulance, which is critical because we know the level of injury. Came off a bike when, conscious now, so that was raising your issue of whether the person actually did lose consciousness or not. It might be deceiving. So we've got key information here, complaining of pain and where it was. So you've got all of that information up there, but whilst you're brainstorming, you put up a lot of other things. Nothing is ever, as I said, on a simple plane. We're trying to play on a soccer field and the ball goes all sorts of different ways. We try to collect all of that bits of information up there so that we can make sense of it. In a good PBL room, we'd actually had 3 or 4 more of these boards so that we could be expanding each of those points as we go along. So the fact that you talked about this, the pain pathway here, we'll get you up there to draw that for us and have that as like a scheme up on another board to help us in refining what we need to know later. Okay. We've done that. So here, the hypotheses that have been put up, we've actually agreed with some and we've got some more. So, yeah, I was just going to say, I just realised we've got a very Australian thing. Can you spot that? Insurance fraud. So somebody who's mimicked this accident and wants to try and get some money. So that's a very typical thing to have, but it's good to put up because, you know, it's somebody brainstorming in the group and they put up that sort of thing. Sometimes they might say, quite often they say snake bite as well. So they have to be able to justify, though, why that point is kept up there. So then you ask, well, why is that? What's the mechanisms of that? And usually then it gets a line through it. That's the other point. Anything that goes up on this board, we keep up there. We don't erase it, we don't rub it off. If we are going to do anything, we will put a line through it if we say that we're not interested in that anymore. Because it shows the group where you've been. And so you're not to repeat not to repeat on that further down, or further information might say, well, that one actually was all right, so then they'll type the line off. So, more information? We're going to be doing that one. So we've actually scooted through quite a few of these. So up here we've got some further information which I should have maybe asked you to put up a little bit more, but there are some obvious ones like along the line of the fracture, having an x-ray. Is there anything else that you'd like to add up on here for extra information that we haven't got? Yes? Really important. Yep. Is there anything else that you would like to put up there?
Glasgow score.
Thank you. Glasgow score.
Oh, yes.
Yeah. So in doing this on the board, so does everybody know what the Glasgow coma score is? What that relates to? I was trying to look at some of our pure scientists at the back, but and What's a good score?
It's evaluate three aspects of the patients. The first one is the movement of the muscle. Yeah. The second one is the movement of the eyes, and finally the voices, the response of the patients to the stimulation.
Thank you. Now, our students most probably wouldn't be able to say that, but can you see up on the board here how we've got a few bits here that they might actually be able to link later on after they've done some research on it? You know, they've got one here about what muscles and things can they move. That might be part of it, and we could actually use that as a hook to link it into when they do some need to know and come back and report on it. So they might not know that at that stage, but it's as a tutor you can actually have those as links to it. I think we've got more information coming. Okay, I made this shorter, so there are other slides on it that I thought I had, but I made it shorter. So you've done a brilliant job. Now, I want you now to work out, if we didn't understand this part here, how are we going to write a learning issue that everybody in our group can actually achieve and understand what knowledge we are actually all going to go away and research individually. So, can anybody work out how are we going to do that? Yeah?
I have a question that in Australia, medical school is the undergraduate score or postgraduate score. In Vietnamese, medicine is undergrad score. So the students don't have basic clinical knowledge. So they don't know about chemistry, don't know physics, don't know a lot of, and so I think in BBL learning, how can teach the basic sound for them? We use that BBL to teach basic sound for students. Thank you.
That's a great question. I'll just do 2 points for that. Is that this course that this case was in is yes, it's presented as a first year case. However, we're in a graduate entry course, so these students have done a previous degree who are in first year, so that would be the equivalent of your third year students doing this. However, we also have some what we call we have a group called clinical science students who come in straight from school, and then they join the graduate entry when they go into their third year of being in uni, which is their first year of the medical course. But those students who come in and even if this was an undergraduate medical course and if it was in a first year, as a PBL tutor, I'd relish that opportunity. I'd love that opportunity, because students who don't have preformed ideas as to what is causing this will ask very basic questions. People who have an idea about it might ask more higher level questions, and we might not get to understanding the basic mechanisms from primary principles because we assume that knowledge. So students who don't have a background that we have in our graduate course, some of them come from being an oboe player in an orchestra and have done a Bachelor of Music, and they get into our medical course. Even at school, they wouldn't have done maths, physics, chemistry, biology. They haven't done those. They've come from music, history, English, or another language. They come into our medical course, and they are, to me, they are key in stimulating the conversation. They will ask the most basic questions, and they might have an idea that nobody else has thought about because they come from a different frame of reference. That makes that soup that I was telling you earlier so much richer. And it also helps the ones who have got that knowledge. It helps them to question that knowledge and then think, well, if I was with a patient and that patient didn't understand, for example, why they had that pain, I could possibly draw them a very basic diagram and say, you know, in your body you've got these nerves and they come down here, and you know, why have I got pain in another part where that nerve isn't? So as a doctor, you've got to be able to break things down and communicate to people who have very little knowledge about their body. This is a rehearsal for that as well. So people who, when you put things up on a board, the students can not assume that knowledge and rehearse drawing and rehearse communicating and rehearse explaining in a very safe environment. So does that help? Did you want to?
Yeah, I think that pretty much covers it. I do understand your worry about introducing PBL in a first-year university course. Many schools do have PBL in their very first year because you design the case and the learning objectives to that level. And that's what we were saying before, there are many different levels. So the levels here might be getting to, and in fact this case is about getting to the fundamental physiology of what a nerve is, about saltatory conduction, about repair mechanisms, you know, about neurochemistry, about receptors and how terminals release chemicals and what the chemicals are, and even the structure of some of those neurochemicals, maybe neuropeptides. Okay, so you can design it so that you are pitched at that level. Most first students coming in first year into medicine have at least basic biology, basic chemistry, basic physics from high school, basic maths. But as Julian was saying, we have about 20% of our graduate entry students have not had a science background. But the other students take them with them, and they learn very, very, very fast, and sometimes they become our top students. Yeah.
Because they don't assume, they ask questions about everything. And it's hard work for them, and as a tutor, one of my roles is actually to counsel them and help them get through that hard road, because sometimes it can be quite an emotional road for them, but as a tutor we form that relationship with them as well. Okay, are you interested in going on and seeing what happens?
We're going to make this the last session of the day.
Yeah. So we've got further information. So would anybody else like to read it out?
So reading out is a process role of PBL. Students read out and they take turns.
Steve says that he was in the city when a car in front of him that was turning left suddenly stopped. Steve hit the back of the car and was thrown forward over the handlebars onto the road, landing on his right shoulder.
Okay, now we've got more information. Now, have you noticed I've just handed Julie a different colour pen? Because what we want to do now is we want to build up this information. So now we're going to have new information. Some of this is going to answer some of our questions. Some of it is going to embellish our key information even more. But we have to highlight where that is. So we use a different colour. So hopefully we're giving you these process tips that can help develop this. So what is key and what's answered some of our information? Landing on his right shoulder. So the significance of landing on his right shoulder?
Lung injury and vascular injury.
Okay, yeah.
Because the rectal bone can.
So he's taken all that force on that area, and we've got all these structures in that area that could actually be impacted on. Any other bits of information? So he's actually thrown over the handlebars. So what sort of structure is in the way of being thrown over? Spine? Head? Yeah. I'm being a really good tutor here, I'm going.
Usually tutor doesn't give any clue.
No, you have to stay there, go. Okay. So does that change any of your hypotheses at the moment? So you want a spine injury in there? I think that's very good. That's the other important thing, is adding things as you get more information. You can do that. Somebody in the last one said, how many hypotheses can you have up there? You can have as many as you think is going to be able to explain what's happening, and then you can always put a line through it, so that's okay. Someone else read?
One examination Steve is found to have swelling and tenderness over the right side of the neck and is unable to move his shoulder without pain. Palpation over the right clavicle produces severe localized pain.
Okay, thank you. Does that help? Right, so we're now focusing in on an area. So up here, Judy, we might put anything else? Pain still in his neck, severe pain in his neck. Unable to move. Now, as this would be a first year case, I would turn around and ask them, what does palpation mean? So it's not assuming that everybody knows what each term means. So it's always about questioning them. You know, what does palpation mean? And I always would struggle and puzzled and, you know, don't know what palpation means, tell me. So sometimes it's good to do that sort of thing because it gives permission for the students to say, well, I really don't know either, and others will turn around and say the same. So you are allowing them to not know and giving them permission to question. Are we going to look at any refining of our hypotheses yet? Maybe not. Maybe we can just still keep them, do you think? Or anything that you think that can have a line through it yet? Or you think it's going to be number one? So fracture you're really keen on? So spine fracture, so we've got spinal injury in there. So what we might do is we might actually rank them. Now we've got a little bit more information. Anybody else like to read? Thank you.
When asked to describe his pain's data, the neck and shoulder pain is constant, a shock of acting on gnawing. The pain in the arm is different, more of a sharp, tingling or burning.
Okay. So what, is there any words in there that you don't know what it means? Yeah?
Cervical fracture.
So you, yeah? Thank you.
Damage the nerve.
So we've got a damaged nerve here. So, yeah, so why do you say we've got a damaged nerve? What's the key information in here that pulls it out?
Yes, because the sensation is burning, more burning or sharp, tingling. Yes.
Okay.
This is the pain of the nerve damage.
Okay, so we can put up here that we've got change in sensation associated with this. And as a tutor, I'd say, well, why have we got this change in sensation? What is the mechanism behind that change in sensation?
Yes, yeah, because I think maybe if he had the cervical fractures, yes, the fracture bone can cause hurt to the sensory nerve, yeah, or yeah, if his clavicle fracture and sensory nerve behind under the clavicle, yes, the fracture bone can hurt.
Okay, thank you. You've given some key words in there that the students might not know. You've said sensory nerve. Do we have other sorts of nerves? Why did you say sensory? What is a sensory nerve? So we're aiming again back down to here. We're going to now put some need to knows and we're going to start to clarify a little bit or narrow down where we want our students to learn. So that was excellent, thank you. So can you see how that works? As a tutor,
the constant pain, constant pain, a shock of acting on constant pain.
Yeah. So I was going to say, does everybody know what gnawing means? Yeah, it's a very Australian. Yes, very good. Do you want to show? What does gnawing mean? You did it with your hand brilliantly.
I think it's something that keep on biting and
yeah, like a rat. Yeah. It was really good. And as a tutor, you'd pick up on those bits. You know, you'd watch the students, you'd be seeing them, and you say immediately that happens. You know, explain it because it was so good. You know, it's very descriptive. But there are people who might not know how to explain these things, how to describe it. And that is also part of communicating in our PBL group.
Notice there are other sharpness, tingling,
yeah,
and many sensory descriptions there to unpack.
Yeah. So you've got sensory, sensations, and things there. Now I'm just going to show you the next bit here. Now Julie's done a great job up here. Because we've got the computer, I can make it a bit neater. Up here. So, as you can see, we've got the red marker out, so we can actually add bits and pieces as we go. So as you I was going to use the pointer, but so in the red we've actually got all the bits of information that we can add. The organisation of the board, as I said before, can actually get quite messy, but in the long run you'll have other boards to be able to put things on it. But Julie's got things as it would really be in a PBL group, because you can't actually say how much space you're going to need to put all the information on. But up here we've basically got the same sorts of things. And we've got the extra of spinal injury. Somebody else has added that on there. somebody's crossed off the insurance fraud because that's not clearly what it is. But we've still crossed it off because we've thought about it. We've answered some questions, and when we answer some questions, we cross them off. And as you can see here, we've got a plan as to how we're going to now start to examine this man. So these cases have a component whereby you're looking at the basic mechanisms, and you have to look at what's normal, then what's abnormal, and then how we're going to manage it. And so these cases pull in lots of things. This would not stand alone as a PBL. The PBL case is a stimulant for the rest of the week, so they'll go into their clinical. They might actually be doing upper nervous system assessments in their clinical skills lab. They might be reviewing x-rays, they might be looking at MRIs, they might have lectures that are associated with this, because this basic nervous system conduction is actually quite difficult. And you know, it's one of those things where we really still don't know how the nerve conducts, because there are scientists who say that the flux of the sodium in and calcium out are too great. How can that actually happen physiologically? So there are still challenges to what we consider a basic nerve conduction out there. So we might have students who come back with that when they do their report back. So the train of thought there, because I get quite excited about that. I like physiology. So the students might have a lecture about that, and certainly at Flinders we have some scientists who are doing research on that, cutting edge research on it. So they come in and they will tell the students, you know, what's happening and what's potentially the theories of the day. And that contextualises it even more for the students. So when they come back and they look at their books and they try to understand how this is happening, it's richer learning for them. It's live, yeah, and it's what's happening in the real world. So now the learning issues. If you were to write a learning issue out of what we've got here, what sort of things would you write? And how do you write a learning issue? Has anybody got experience in writing learning issues? Do you know what I mean by a learning issue? Okay, a learning issue is an area that students believe that they need to go away and learn to understand this case. To be able to write it, you have to be able to define what you want to know. You have to be able to refine the area that you want to know, because you can't go away and learn all about the sensory nervous system, because that's beyond the scope. We want to learn about a certain aspect of it. So in writing these learning issues, we might actually be going right underneath and saying, we want to understand how nerves conduct impulses, but we specifically want to know about the sensory nervous system of the arm. So then they'll come back and they'll have diagrams of the nerves that we've been talking about. They'll come back with diagrams of the distribution of sensation on the arm. They'll come back with information that might have, some students come back with a lot more information than you actually need to understand it. But I always find that if they've gone away and come back with huge amounts of information, it's always, I feel it's my duty to let them show a little bit of it, because they've done work, and I really enjoy people who love learning. And so I allow them to have a little bit of it, but it can confuse others. So you have to work that one out. You have to be able to control that a little bit. But let's anybody got an idea? It's always good to have a learning issue as a question. So what questions associated with this do you think you'd like to write?
So put yourself in the shoes of the student. and you have to go home and you need to study this. If you go home with pain mechanisms, what are you going to study? Where are you going to find that information? You know, big books on that kind of topic. So how can we help you focus so that you focus down on to help you what is relevant to this case? So is it all pain mechanisms we need to know, or some specific mechanisms? What specific types of pain are we talking about here? Nerve damage. What's the name for the sort of pain you get from nerve damage? So we might say, let's make it that simple. What are the mechanisms of pain in nerve damage? There's specific types of nerve, and they'll come back, they'll read up about it. They won't have this word when they leave with the learning issue, but when they come back, they'll have learned about neuropathic pain. Yeah? So it's helping them to narrow down what they read so that they don't pull out and have to read the entire physiology textbook or Randall and Schwartz, neurosciences, or any of that in one hit. So narrow it down.
And here I've got written down how to help them define it. Now these are only a few tips that I've put down, and students will by themselves do this automatically, but it's ask what do you need to know to find out to help understand the underlying problem. Write learning issues as questions. If you write them as statements, they're kind of like a bit closed, whereas if you ask them as questions, it gives them scope to look it up. Should be specific areas of knowledge. One of my first year groups in human homeostasis, one of their cases was on the autonomic nervous system, and it was only on a small, we were just looking at the role of adrenaline. These students wrote a learning issue, understand the autonomic nervous system. I let them go, and when they came back they said, oh, that's huge. And they said, oh, you know, in looking at it when we were going and researching it, I think we only need, you know, this part here looked as though it was more relevant than the whole lot. And I thought, they've learned quickly. But they didn't ever do that again. They had to refine it. So it is good sometimes to let them go off and make a few mistakes. Safely, but it is sometimes more learning. Also write them the learning issues as a logical dissection of the problem. So we've got this problem here. We want to know why he's got shoulder pain. We want to know why he's got these changing sensations. He's got these other issues there. We want to understand it. So these are the underlying pain that we want. There are lots of resources that the students can use. Here's some examples of how they might write them. The first one's not written as a question, Julie's just said. That's true. Anatomy of nerve supply to the arm and shoulder. Should really be what is. What is the significance of the different types of pain? And what causes pain? The relationship between tissue damage and the brain's perception. So that's looking at what we brainstormed in the group. Where did you write it, Julie? CNS and down here. So we had all of this that you put in there. So we've written them very clearly, defined, and the students will go away and they'll come back with what I'll show you in a little while. Sorry. I'll just let you go through. So this is the plan of it. So we actually we've only just done this first section up the top. Students will go away and they will all research the learning issues, every single one of them. They won't, sometimes they like to allocate learning issues and only do one and present one. That's not good in my book. They have to go away and all research them, and then they come back for reporting back. Now that's what we're going to have in our workshop. We're going to have some of our students, when you're the tutor, they're going to go away and report back. What I might do is just quickly go on. So here is the learning student learning evaluation, and I don't know whether it's very clear, but some of these are quite specific. You can see some of their objectives up here. The first one is describe the anatomy of the peripheral and central neural pathways that carry afferent information. Now, students at that time, after they've come back on their research, will know that there are afferent and efferent, so they'll be familiar with these terms. And here, classify pain according to the type. Appreciate that stimulus does not always lead to the same sensation. Is there questions about it? So this is an example of the learning objectives that are part of the curriculum that we've tried to get to here, and we've only gone through a small section of this case. But we're touching on most of them, but the full case we have filling it up. I've really noticed that we're running right over time. So is there any questions, any comments, any concern?
So at this stage, we are going to evolve the training to fit with our pace and what you need. So we were going to do another session now on the tutor role, but it's out of time because we want to take things through at a good pace and also to make sure that we are working at a pace across 2 languages. I'm aware that working in another language is very tiring. Your brain has to work so hard. So we're going to finish now, and when we come back tomorrow, we'll get you to be students in a PBL case, and it will be very active and I think energising. And then after that, we'll brief you on the switch to being a tutor, and then in the afternoon, you're going to have a go at being a tutor with a real student group. So tomorrow is much less of this. We'll be working in PBL rooms, we'll be much more active, and hopefully you'll have